iFR was introduced in 2014, already developed a few years before, of course, but what the major contribution was shortly after introduction is that it increased the adoption of corneal physiology in the cath lab. With FFR we learned that many lesions are not significant and should not be treated. But with a new parameter you always need to have evidence if that new parameter is just as good as the more traditional one, in this case the FFR. And that was actually the question, if you look back, in the direct comparison in both the Define Flare study as well as the Sweetheart study. They did a direct comparison between the clinical decision making between iFR and FFR. And it appears to be, at least at 1 year, there was not any difference. So that was actually a major contribution that iFR was very useful for clinical decision making into the cath lab. So iFR helped the adoption of corneal physiology in the cath lab because it's a little bit more simple than FFR, because FFR requires hyperemia and iFR is a non-hyperemic. So we just concluded that iFR and FFR for clinical decision making, that is quite similar, but because it's a non-hyperemic parameter, it also has some advantages. Consider that the coronary artery does not only have one lesion, but there are several lesions, or sometimes it can be diffusely diseased. Then the iFR is an elegant method because you can select which kind of lesion should you treat. So you can just put in a stent for the whole segment, but you can also say which part of the lesion is contributing to the complaints, and therefore you have a pull-back device. It's called a sync vision, and that gives you more information about which lesion should you treat or which part of the lesion should you treat. And that is something which is not possible with FFR, because if you have hyperemia, you always have, with sequential lesions, you have interplay. So that makes it much more difficult to decide which one you should treat. And that is the advantage, to my opinion, in my personal view, the major advantage of iFR as compared to FFR. It gives you more a clear answer, which lesion should you treat, if you have more lesion in one artery, or which segment of the lesion should you treat.